in a second.
Yeah, Richard.
All right, thank you for joining our noon plus press conference today about COVID-19. We're going to start today with our speaker, Dr. Dart. Go ahead, Dr. Dart.
Thank you, Richard, and good afternoon, everyone. Today, we are reporting an additional 310 Tulsa County residents who have tested positive for COVID-19. That brings us to a cumulative total of 37,459 people who have tested positive since the pandemic started. Good news, we have 32,558 people who have recovered, and we have currently 4,609 confirmed active cases of COVID-19 in Tulsa County. Since our last press conference on November 19th, 46 more Tulsa County residents have died from COVID-19, including 2 deaths reported today, both males over the age of 65, which brings the total to 292 Tulsa County residents who have lost their lives to COVID-19. Please, as always, keep your thoughts and prayers for these families. To give you an overview of Tulsa County data, more Tulsa County residents tested positive in November than any other month, with more than 10,000 cases reported in November. After our first case back in March, it took just under 6 months to reach 10,000 cases. What took 6 months now only takes 1 month. October was previously our highest month, and November nearly doubled that. On November 1st, our 7-day rolling average of new cases was 175.3. By November 30th, it had doubled to 420.9. As of today, that 7-day rolling average is 469.4. There, as we said, there's over 4,600 active cases in our community right now. And at the last press conference, we had over 4% of the entire population of Tulsa County had already tested positive for COVID-19. We are now over 5% of the population, and if these current trends continue, we'll reach over 6% within 4 days. Due to deaths so far from COVID-19, it's now the 7th leading cause of death for Tulsa County residents when compared to 2018 top causes of death, and 2018 is our most recent death data. This is incredibly concerning since we have less than 12 months worth of COVID-19 death data, so more than likely that metric will be higher. If this trend continues, it's on track to be the number 6 cause of death in our county before the end of the year. Over 2,500 Tulsa County residents so far have been admitted to hospitals since the pandemic started. Talking about testing, quarantine, and isolation, they remain critical to slowing the spread of COVID-19. Completing the entire duration of your quarantine isolation is extremely important. Last week, the CDC and the Oklahoma State Department of Health announced options to shorten your quarantine based on testing results and symptoms. Reducing the length of quarantine may make it easier for people to quarantine by reducing the time that they cannot work. The CDC does caution, though, that any quarantine shorter than 14 days balances reduced burden against a small possibility of spreading the virus. And so we really want to emphasize that with the shortened quarantine, it's imperative to continue to wear your mask for the remainder of what the 14 quarantine would have been when around anyone at all. So, and yes, you know, the message keeps changing. I know it gets more confusing. We understand that. So bottom line is that if you've got questions about quarantine, please call us, and we're here to help. Call 918-582-9355 and speak to a professional. And we appreciate all cooperation with these scientific mitigation strategies, because as we've learned since the beginning, everyone's actions matter. Remember, if you're sick, you think you may have been exposed, or just want to be tested, please call us to schedule an appointment online. And once again, that number is 918-582-9355. And we do have an online appointment option as well. We continue to see an increase in the number of people seeking testing from Tulsa Health Department. On December 4th, we collected the most samples in one day since the pandemic began. But fortunately, our supplies and our capacity remain strong at this time. Last week alone, we collected 870 samples at our THC testing sites. And our percent positivity rate just last week was 27.82%. In November, the percent positive rate for November was 23.12% for testing done by Tulsa Health Department only. THC, we continue to update our zip code risk map every Friday so residents can view the risk for their own zip codes and see clear guidance for each zip code according to that risk. Last Friday, our map was updated with an expanded color system and new guidance for residents within extremely severe zip codes. The thresholds that we list are based on Johns Hopkins metrics for understanding the reach and severity of risk. When we realized that several zip codes were more than double the rate for the red level, we recognized the need to expand the color system to more clearly illustrate the severity of the spread of the virus throughout Tulsa County. Under this new system, there are now 4 shades of red to delineate risk. The 3 darkest shades of red are designated as extremely severe risk, and currently 35 out of 42 Tulsa County zip codes are designated as severe or extremely severe risk. You can view the map and clear public health recommendations for each color on the THC website. If your zip code is red or extreme red, we encourage you to stay at home unless you are essential personnel or seeking food or medical care. We want to thank everyone who chose to celebrate the Thanksgiving holiday safely. Your actions directly impact the health and safety of residents by limiting the spread of the virus. Upcoming holiday celebrations will need to continue to be different this year to prevent the spread of COVID-19. So please, we continue to asking everyone to avoid activities that are highest risk for spread. Consider fun alternatives that pose lower risk of spreading COVID-19 if you can. We know that it's important to continue with family traditions that are really critical, especially this time of year. If you can modify those to keep everyone in your family as safe as possible, that would be outstanding and be amazing. And frankly, I think we're going to see some new traditions that have been created, I think, since COVID came. So choosing safe ways to celebrate this year will help ensure many more happy holidays with your family. And we're really focused on the future. And I think that's important. We're not going to be in COVID forever. So it's imperative that we really maintain that and pay attention to our effective, fast, fact-based approach to stopping this pandemic. Of course, as always, we recommend following the 3 W's: wearing a mask, watching your distance, washing your hands, continue to be paramount to keep everyone safe, and more importantly, those who care about safe, so that we're all around for more holidays to come. You know, we'll be sharing some, I think, exciting news about a safe and effective vaccine, and it's right around the corner. But it's critical to continue to follow these fact-based prevention measures to stop this vaccine or stop this pandemic, even when we do have vaccine. But to speak more about COVID vaccine and the Tulsa County plans for initial distribution of vaccine, I'd like to introduce THD Clinical Services Manager, Ellen Niumatalo. Ellen.
Thank you, Dr. Dart. Please stand by. We now have Ellen Niumatalo with Tulsa Health Department. Ellen, could you please unmute your microphone? We now have Ellen Niumatalo with Tulsa Health Department. Ellen, could you please unmute your microphone?
I did. Am I not? Can you hear me now?
You're on now, Ellen. Thank you very much.
Perfect. Okay. Yes. Thank you, Dr. Dart, Mayor Bynum, Commissioner Keith, and others for the opportunity to speak today about such an important matter. But before I start speaking about the COVID vaccine, I want to remind everyone to get their seasonal flu shot if you have not already done so. It's especially important for people with certain chronic conditions like asthma, heart disease, and diabetes to get vaccinated. Okay. Yes, thank you, Dr. Dart, Mayor Bynum, Commissioner Keith. Excuse me for a moment. Let me get some feedback such an important matter changed. But before I start speaking about the COVID vaccine, I want to remind everyone to get their seasonal flu shot if you have not already done so. I apologize. I had some feedback issues here. Again, like I was saying, the flu vaccine is especially important for people who have certain chronic conditions like asthma, heart disease, diabetes. Getting a flu shot makes it less likely that you'll have serious flu complications or wind up in the hospital. Flu vaccinations can reduce the burden of flu illnesses on our medical system so that we can focus on individuals and patients who do have the COVID-19. So to get a flu vaccine, you can request an appointment with the health department online, visit your primary care provider, or check with your pharmacy. THD also has so far administered over 9,000 flu vaccines in our clinics and on the caring van this season. So we just wanted to continue to encourage everyone to get their seasonal flu vaccine. But wanted to say I am the manager of clinic services at the Tulsa Health Department, and throughout my career in public health, both in Tulsa and other counties, I've participated in several public health responses. The COVID response is the largest response by far that I've experienced so far. But also in my experience and in research and what I have learned, I'm really committed to the use of vaccines to reduce the incidence of diseases in individuals and in the communities. The availability of a COVID vaccine is really quite exciting as we're moving forward to respond to this COVID-19 pandemic. So I briefly wanted to touch a little bit about what the timeline is currently for the vaccine. Both the Pfizer and Moderna vaccine have applied for emergency use authorization, and that application went to the FDA. They have been reviewing all of the data, and the Vaccine and Related Biologic Product Advisory Committee of the FDA is scheduled to meet tomorrow, which is the 10th of December. And they really are looking at two issues. One, they want to know, is the vaccine effective in preventing disease? And two, do the known and potential benefits of the vaccine outweigh the known and potential risks of that vaccine? So they are going to be looking at those two specific issues. The ACIP, which is the American Committee on Immunization Practices, which is an arm of the CDC and provides us guidance, quite frankly, about all of the vaccines. They are scheduled to meet this weekend, and they will continue to provide more clinical guidance specifically for these vaccines. The vaccine will be shipped to the designated areas after the EUA is approved. So the hope is that the vaccine will be shipped on the 15th. It will be received at the designated facilities on the 16th, and then the administration could begin as soon as the 17th. So the Tulsa Health Department and Tulsa County does have a plan for the administration of this vaccine. The Tulsa Health Department has been working very closely with the Oklahoma State Department of Health and our community partners to ensure that this vaccine is available to be administered as soon as it is approved and received. So the prioritization as to who's going to receive the limited doses initially is provided with the framework from the Oklahoma State Department of Health, based on some of the guidance also from the Centers for Disease Control. So the initial limited doses available are going to be allocated to the healthcare providers who are frontline workers. These are the workers who are caring for our COVID-19 clients or potentially could be caring for the COVID-19 clients. We say we want to take care of the people that are really taking care of us. So those individuals will be identified by their healthcare facilities, and they will be contacted to go ahead and schedule an appointment. So when the appointments are made, there are days and set up for the clinics where the vaccine can be administered in as safe as administered in as safe of a manner as possible. We have to maintain distancing for the individuals who present to come and get the vaccine, much as we would with any other procedure or any other process. The other little bit of a unique thing with this vaccine is after it has been administered, those individuals are going to have to remain for a 15 to a 30-minute observation period. So that has to be built into the plan, again, wanting to maintain the distancing during this whole entire process. The tracking and the documentation of the vaccine and the doses administered is certainly a priority. and will be happening in real time. We are using a couple of different systems, but it will be documented through the OSIS, which is the Oklahoma State Immunization Service website, where all of those vaccines will be documented. Then also briefly wanted to just talk that vaccines historically are safe and effective. They are well studied, they are well documented, and they reduce the incidence of disease. We can look historically at some of those vaccines. Polio is no longer a feared disease. We no longer have individuals who are in iron lungs or on respirators simply because of the paralysis caused by polio, let alone the long-term effects that we have seen in some of the people who have been stricken with polio. The measles vaccine is very effective in preventing serious disease. Thankfully, we are seeing very few cases of measles. It would be lovely if it was none, but thankfully we're seeing very few cases of measles in our society. Another one where Oklahoma actually rather led the nation would be in our hepatitis A. The incidence of hepatitis A disease dropped after there was a widespread use of the vaccine, and Oklahoma really was leading the nation in that. So as individuals are considering whether or not that they are going to be receiving the COVID vaccine, first of all, ask your healthcare provider for advice. They want to make the best decision, and I know that individuals want to make the best decision. Refer to the experts as you are looking into any of the information. The information currently that we know about the vaccines is that it's 95% effective in preventing COVID-19 disease. That's a wonderful number. So that was measured actually 7 days after the administration of the second dose. And each one of these is in a 2-dose series. The local site and systemic events really are mild or moderate with very few severe incidents of events after the vaccine. The incidence of both those mild and moderate systemic events happened more after the second dose than the first, and interestingly enough, seemed to happen more in the younger age group rather than the older age group. And that was true of actually both of the vaccines. So specifically for the Pfizer vaccine, any of those local or systemic events, the median duration was 1 day, and it's the frequency of the severe adverse reactions was really low at 0.5%, and the duration of those was approximately 10 days. So again, the frequency of severe adverse events was very low and did have a 10-day duration. The information so far that we've received on the Moderna vaccine is that the same thing. Local site and systemic events really are rather mild to moderate, with very few, if any, of the severe events following the vaccines. So wanted to just let you know that, yeah, the Tulsa Health Department and the community has a plan in place to begin administering the vaccine as soon as it becomes approved and available. It will be based on the priority groups that have been set by the Oklahoma State Department of Health. And really quite excited about the possibility of this being one of the tools that we have available to help in response to the COVID-19 pandemic. I like to say that there is a little bit of a light at the end of the tunnel, which is really quite exciting. Don't get me wrong, we still are in the tunnel and we still have to practice our other measures of wearing the mask, watching your distance, and washing your hands frequently. But it is exciting to have one more tool that's going to become available for us very quickly. So again, thank you for allowing me to speak on this topic. And Dr. Guy Sneed from Hillcrest, I believe you are next.
Thank you, Ellen. Please stand by while we bring our next speaker on. Our next speaker is Dr. Guy Sneed with Hillcrest Healthcare Systems. He's the Chief Medical Officer. Dr. Sneed.
Thank you all, Mayor Bynum, Dr. Dart, Ellen, Karen, and others responsible for the call today. I'm Guy Sneed, Chief Medical Officer for Hillcrest Healthcare System here in Oklahoma. And I was asked just to give a brief overview of our current state with COVID, brief snapshot. And then after that, I'll turn it over to my colleague, Dr. Brian Worley. But just to give you an idea, here in Hillcrest Healthcare System, we have seen what feels like a month-long incremental surge that started around November the 1st. It appeared to have peaked December the 1st, and then we've had a little bit of a reprieve over the last 7 days. Now, important to note that as of yesterday, we began to see that uptick in COVID inpatient volumes again here in our healthcare system. And that would be right on target with some of the predictions that we have heard, most notably from Dr. Dart and his team. And so that's to be expected. You know, what we are seeing in regard to challenges, I think all of our partners in the healthcare community are seeing as well. You have heard some of that in regard to maybe capacity or space challenges with actually admitting patients into the hospital. But what I would tell you is this: while there are always challenges with these sorts of things, and when we are surging, we have a great relationship amongst ourselves, the hospitals in the Tulsa metro and the county, and we are talking daily, sometimes hourly, and really working with one another to make sure that our patients, their needs are met, and are considering if those patients need inpatient services, that those patients are getting those. And so we have built really strong relationships in that regard. Since the pandemic started, you know, the Tulsa hospitals have been in surge planning for these sorts of events, and making sure that we had contingency plans to accept patients and to care for them appropriately. And I would say that as late as this week alone, our hospitals, not just Hillcrest Healthcare System, but our partners, are working on ensuring that we have the appropriate highly trained staff, and that we have the appropriate spaces that we need that are both dedicated for our COVID patients, but that also can meet the needs of our patients that do not have COVID, but still need to be admitted to our hospitals. And so I wanted to reassure you there, we are all working together very well for our community, and feel really good about where we are at currently in our preparedness. As far as treatments and therapies go, I was asked to just talk about that just a little bit. And what I would say is that most of you have probably seen in the news in one form or another, just a litany of new therapies and treatments that are coming out sometimes monthly or weekly. And I think that's a testament to who we are as a society, but also as a community, but more so from our vantage point than just the treatments or therapies, is the human component. And really, we have seen the resolve and the resilience of our healthcare workers, our frontline clinical teams that are caring for patients daily, and how they've adapted and overcome and really developed the know-how, if you will, or the expertise to really identify our patients early and then initiate the safest, most evidence-based care algorithms and protocols, if you will, for our patients. And so I've been very pleased, highly impressed with what we've been able to do in the community. You know, I think that from an advice standpoint, I know we're getting the vaccine, and we're so thankful about that. You know, hopefully that's going to be a game changer for not only for us here in the community, but nationally in the world, globally. But I think, you know, it's still about some of the foundational elements that we continue to promote, which is, you know, masking, social distancing, and then of course hand hygiene. These are foundational for any program or anyone that desires to prevent the transmission of COVID-19. And so, I would have to continue to support that and hope that those in our community will as well. However, if you do fall ill from COVID-19 or any other condition, illness, disease, just know our hospitals stand ready and prepared to care for you and to deliver the safest, most evidence-based, effective treatment and therapies possible. And so just want our viewers to know that. And then one final thought, with the surge that we are seeing and with the large numbers of COVID in our hospitals and that we're hearing about, it may be that someone may think that, well, maybe I will hold off on that test or that annual exam, or even worse, I feel ill, but I don't want to go to the hospital because I fear that I may catch COVID or that I may be jumping line and someone that's sicker. Listen, we have plenty of capacity. We have expert staff, and we want you to go to the hospital. We want you to see your healthcare provider. We want you to continue to get your health maintenance needs met. We want to see you. We want to take care of you in a timely fashion. We don't want to risk your health declining further because you've put something off that you really need. And so that would be my final thought today. Thank you.
Thank you, Dr. Sneed. Please stand by for our next speaker. Our next speaker is Dr. Brian Worley, Hillcrest South ICU Medical Director. Dr. Worley, please unmute your microphone.
Oh, there we go. Can you hear?
Yes, sir.
So I just wanted to thank Mayor Bynum, Dr. Dart, and all the other participants for allowing me to participate. I'm going to talk really briefly just about, from a clinical standpoint. I'm the medical director of the ICU and the respiratory therapy department here at Hillcrest Hospital South. And, I wanted to make sure that the community is aware that, the staff here are doing well. They're motivated, they're trained, and, we're ready to tackle whatever, frankly, is thrown at us. If we have plenty of ventilators. We've frankly have a stockpile of ventilators if needed, and the staff is holding up well. I think that one of the things that needs to be pointed out, that the nurses, the staff, the respiratory therapists, when they come here, they're really risking their lives. The ICU, most of the patients in here have active COVID infections. And so this environment is literally covered in COVID. So not only are they risking their own health and potentially their lives, they're risking their families' lives, because, a lot of these nurses, respiratory therapists, they're married. They have husbands, wives, kids. But it's amazing to me that you just don't hear them, complaining about, the pace of this, the acuity, the risk. I mean, they come in, they do their job, they go home, they come back, and they do it over. So as far as the pace, it is higher than, what I've ever experienced. But we are ready to meet whatever is thrown at us. One of the problems that we have with families is typically we would allow families to be present in the ICU with their loved one, family member. Because of the COVID infection, we really can't allow that because of the risk to them coming in and then taking it out of the hospital. And so it's extremely isolating for the families. They can't see what's going on. They talk a couple of times. We do the best we can. We do Facebook or FaceTime, my apologies. We do FaceTime. Families are able to see, how their loved one's doing, but it's still not the same. We do allow family to come up, unfortunately, when we're withdrawing care on patients, which unfortunately happens. In those situations, families are able to come up and be with their loved ones. We have had some fabulous saves, some unbelievable saves, and we'll continue to have that. The treatment that we're doing right now with COVID is very dynamic. Initially we were given hydroxychloroquine, all these other medications. Now we're not doing that. Now we're giving steroids, so right now the treatment for COVID is evolving. Fortunately, we've got the vaccine coming. One of my charge nurses asked me earlier today if I'm getting the vaccine, and I said, don't block my path to the vaccine. The answer is absolutely. My response, if you can get the vaccine and don't take it, then I would consider having you come up and see what happens if you get the COVID infection, because it's not pretty. These patients are in the ICU for weeks at a time. I had a patient who unfortunately passed away last week. She'd been in the hospital for 60 days on the ventilator. But again, we are ready to meet whatever challenge is thrown at us. And at that, I will conclude my part.
Thank you, Dr. Worley. Please stand by. Our next speaker will be Mayor G.T. Bynum. 1 second while his audio is connecting. Mayor Bynum.
Thank you. Just a couple of updates from us at the City of Tulsa. But before I get to those, I really want to follow up on what you just heard from Dr. Worley and what I'm hearing from folks who work in our hospitals throughout this city. And that is the real challenge of addressing this virus, not being able to keep it out of sight, out of mind, but going to work every single day and seeing what this virus can do to our neighbors. And because of the contagious nature of it, these are patients that aren't able to have their families with them to support them, to lift them up as they go through their treatment. Can be very isolating for the patients, can be very hard for the folks who are there to try to save their lives and provide them with really the last line of medical care that is available in our community. And so what I would ask for all Tulsans as we move ahead over the next several weeks into and through this holiday season, please think about our healthcare heroes that are here in our community. I feel like we did a really good job of that in the first month or two of this pandemic. I remember signs that people would put up. I remember all the messages on social media of support for our healthcare heroes. I remember people ordering meals and sending them to hospitals for the staff that work there around the clock. And I feel like as this pandemic has normalized, so many folks in our community have quit doing those kind of things. And we have to remember that the healthcare heroes in our community are working harder today to address this pandemic than they have worked at any point in the midst of this pandemic. The contagion rates and hospitalization rates are at all-time highs. The strains that you would see on a hospital system between October and February are always high every year anyway. And then you add a pandemic on top of that. So please think about what you and your family and your friends could do to show your appreciation for the people who are working so hard in our community to save lives. There is not enough that we can do as Tulsans to show our appreciation. But I've seen firsthand this year how good Tulsans are when we're reminded that we need to say thanks and show our thanks to folks at what a good job we do of coming together as a community to do that. And so over the next several weeks, please take some time to think about what you can do to show your appreciation for these folks who are working so hard to save lives in our city. A couple of updates from the City of Tulsa standpoint. The City Council passed a update to our mask order in our city the week of Thanksgiving. That allows the Tulsa Health Department greater authority to enforce our mask ordinance in businesses. It's really important for folks to understand the point of this ordinance is not to have staff from the Tulsa Health Department lurking outside a business waiting for one person without a mask on to walk in and then go shut them down. They don't have the staff for that, and that's not the intent of the council and I. The purpose of this is that we do have, unfortunately, some businesses that are trying to capitalize financially on marketing themselves as places that don't care about mask wearing or the hygiene and safety of our fellow Tulsans. And that isn't fair for the businesses that the vast majority of businesses that are trying to do the right thing and keep people safe. And so this will give the Tulsa Health Department the ability to shut down those businesses that are not following the law as it has been established in Tulsa. People can report to the Tulsa Health Department concerns that they have about individual businesses, and that is on the City of Tulsa's COVID landing page at cityoftulsa.org. Our municipal courts, because of an increase in cases, the Tulsa municipal courts are scaling back court operations to reduce the number of citizens that would be in our municipal courthouse. All arraignments and conferences scheduled for December 11th through January 20th will be passed for 60 days. Defendants with preset tickets can call to request an extension of time for payment or appear at court and sign a plea and waiver form in order to make payment arrangements. Through January 20th, warrants for failure to appear and failure to pay will not be issued until after that date. And all defendants with a bench warrant who appear at court will have their bench warrant recalled immediately and be given a court docket to return in 60 days. At the City of Tulsa, throughout this pandemic, in spite of the fact that we've been operating in a national recession and a global pandemic, we have been able to continue our operations and our service delivery in a largely unchanged way. And that is thanks to two main things. One, having a city council that was willing to prioritize saving money in good times over spending it, which allowed us to build up our rainy day fund. The other is that our non-sworn employees at the City of Tulsa have been furloughed a half day every week since May. And that will come to a conclusion at the end of this month. I really want to thank everyone on our team at the city who has sacrificed their own pay to protect the safety and well-being of Tulsans by allowing our first responders to continue to work without the reduction in hours that the non-sworn, those of us at the City of Tulsa who are non-sworn employees, have had to take. Just as a reminder, our permit center remains closed for in-person business through the end of the year, but Tulsans can still utilize the online permit portal, which you can find at cityoftulsa.org. Now I'd like to turn it over to my colleague, Tulsa County Commissioner Karen Keith.
Thank you, Mayor. Please stand by. Our next speaker is Karen Keith, Tulsa County Commissioner. Karen, can you please unmute your microphone? Thank you.
Hi, everybody. Mayor, thank you again for your leadership and your dedication to the health of our region. Also want to say congratulations to our mayor, Bruce Dart, and all of our healthcare providers on your recognition by the Tulsa World Magazine for all your selfless work. You are the true heroes, like our mayor said. And Dr. Dart and the healthcare providers, they're the centerfold in this magazine. So I hope you'll pick it up. And this is one way our city's been able to say how much all of their work is appreciated. Here at Tulsa County, there is a lot happening. Tulsa County Cares Review Committee, chaired by Commissioner Ron Peters. They've worked tirelessly since receiving the $114 million in CARES Act funds from the federal government in April. They have diligently reviewed every application and successfully allocated it to all corners of Tulsa County with a deadline that is fast approaching at the end of this month. Now, since April, Tulsa County's allocated more than $3 million in protective equipment supplies, $4 million to help those with food insecurity, and some $3.7 million for public health issues like testing and contract tracing. And then just 2 days ago, $3.5 million was approved for utility relief to help the thousands catch up on their delinquent electric and gas utility bills. I am so grateful for all the efforts of the review committee. Now, the county's also worked in tandem with partners at the Tulsa Economic Development Corporation, that's Rose Washington, the Tulsa Community Foundation, and the Tulsa Housing Authority to identify small businesses and nonprofits that needed funding support to survive. Those funds helped working parents find safe and secure locations where their children could distance learn and to provide those facing eviction with rental assistance. As we approach the December 30th deadline, our finance team has taken the reins and is hard at work reconciling every dime spent. And as the program winds down, I invite you to take a look at the Tulsa County Cares website to see where all the funding has gone, as well as the positive impact that area businesses, service providers, and so many others have experienced. So let's shift to another area that has been impacted by COVID-19, and that's the Tulsa County District Courts. They made some major adjustments to court operations last week that I want to touch on. Criminal courts are still operating virtually. In custody felony arraignments, the bond docket, are ongoing on a daily basis. Judges can still take waivers of preliminary hearings and felony pleas to keep the jail population moving. Protective orders and emergency domestic cases are still being heard. Civil courts are still operating all virtually. Now, trying to eliminate the overcrowding here at the courthouse, jury trials are suspended until February 1st. All proceedings at the Family Center for Juvenile Justice, those continue as scheduled. This includes eviction dockets, which were moved to this location in June for better social distancing. Now, tomorrow, the courts have 79 eviction cases lined up. They're spaced out from 2, 3, and 4 p.m. Full details on the changes to court operations can be found at tulsacountydistrictcourt.org. While the majority of court-related activities are postponed or virtual, the courthouse does remain open with access to the treasurer, the assessor, the court clerk, BOCC, and other departments. That said, we ask that you conduct your business over the phone, by email, or traditional mail as much as possible to protect both yourself and our employees. A full list of contacts for every office and elected official can be found at tulsacounty.org. Lastly, as many have already said, please help our first responders, our doctors, our nurses, EMTs, the police and sheriff, our firefighters, by practicing the 3 W's: wear a mask, wash your hands, and watch your distance to help spread help stop the spread of this this virus. This is our best shot at keeping our businesses open and, more importantly, saving lives. I'm grateful to all of you for doing your part. Stay safe now and for the upcoming holidays. Thank you all.
Thank you, Commissioner. If you'll please stand by, we'll bring all of our speakers back in the room to have a question and answer session. Okay, I believe we have everybody, and if you can hear me, we have a series of questions, and I'll start. The first question is from Fox 23, Rick Marinon for Dr. Dart. Does THD have the necessary freezers for the Pfizer vaccine, or are you shooting more towards the Moderna vaccine because it's less demanding? The second part of that is, do you even have a choice, or do we get what we get?
So we are getting vaccine from both Pfizer and Moderna, it looks like now. And we don't have the freezers for the ultra cold Pfizer heater, but we do have partners in the community who do have freezers and we will pre-position our vaccine at those facilities, healthcare facilities. So that's where we feel very comfortable with how that's going to be pre-positioned and how we will distribute from there. And then, you know, so far the feds have promised that initially we'll get doses of vaccine from Pfizer. A few weeks later, we expect to start receiving doses from Moderna, and then the cascade will just continue after that.
Thank you. Next question from Fox 23, Rick Marinon to Dr. Dart. What happens to local testing when the CARES Act money that helps cover testing costs expire at the end of the month of December 30th? Do people need to be prepared to pay more out of pocket for COVID tests in 2021 as we wait for a vaccine?
So that's a really good question. You know, easy answer is that we're hoping for CARES 2 money. If that doesn't happen, we're having conversations here right now within our agency to figure out how we can continue testing. And as you know, we'll have to be doing testing and vaccine distribution all at the same time. So we have quite a bandwidth responsibility coming, and we're doing our best to make sure that we meet the responsibility of both testing and vaccine distribution.
Thank you. Next question, Rick Marinon for Ellen. When do you think the average person will be able to sign up to get a vaccine? And can you walk us through how this would happen? We've heard people talk about Walgreens and CVS being places to go to get this vaccine. Is that something THD is looking at when it comes to a place people will go to get the vaccine? Ms. Niumatalo, you have to unmute your microphone, please.
Okay. Yes, the vaccine actually will be coming in waves, and the initial doses are very limited. But as the more vaccine is produced, and probably some of the other people who are making the vaccine, as it becomes authorized for use, we are really anticipating throughout 2021 that there will be plenty of vaccine available for everyone. Additionally, there are several people who have signed up to be providers of the vaccine. So different healthcare facilities, different pharmacies. So throughout 2021, and my hope is pretty early in 2021, some of these other providers will start receiving the vaccine and be able to start administering that. The best guess is possibly late spring or early summer. There really will be an adequate supply of vaccine available for anyone who seeks to get the vaccine.
A follow-up question also from Rick Marinon is, when the time comes for someone to get a COVID vaccine, will I be able to schedule my follow-up at the same time I get the first shot to make sure I can get the required 3-week follow-up on time?
Yeah, that's a great question. Initially, when the appointment is going to be set for the first dose, there will also be an appointment set for the second dose. With the Pfizer vaccine, it is 21 days. With the Moderna vaccine, it's 28 days. So depending on which vaccine is being administered, that follow-up appointment will be set initially at the same time to make sure that we have the right timeline.
Thank you. Next question, Fox 23 for Dr. Sneed. How close would you say Hillcrest is towards that critical Tier 4 place in the hospital surge plan?
That's a great question. Thank you for that. As a division, we are not that close. We do have episodes where one or more of our hospitals may be in Tier 3, but there are some influx and kind of efflux of patients. And over the last several weeks with some of these latest surges, we think we just kind of get to that level where we need to start to consider what the next tier looks like, and then we've had a reprieve. And so this latest surge, we did get close, some of our hospitals, but we certainly weren't there. We do have plans in place if that happens, and I think I mentioned earlier, within Hillcrest Healthcare System, we are weekly standing up more dedicated capacity or space to take on more and more COVID dedicated patients, whether that's in our med surge areas or even the ICU.
Thank you. Next question, Fox 23 for Dr. Sneed. Can you address the claims in a White House report that there are people in Oklahoma hospitals with the flu and COVID at the same time? Are you seeing any of these cases? How critical are these people dealing with a double infection?
That's a great question, and it is true. Patients can acquire both COVID-19 and the flu. We have seen those patients in our hospitals invariably, because you have two viral infections that primarily affect the respiratory tract, and then obviously can affect many other organ systems. These patients can get profoundly sick. So we are seeing that. It's not particularly common, but every time that we see a patient with symptoms that would suggest either COVID-19 or the flu, that could be something as simple as an upper respiratory infection or a slight cough with fever. Our index of suspicion for either COVID-19 and or the flu is really high, and we are generally testing for both.
Thank you. Fox 23, Rick Marinon for Dr. Worley. Is this the toughest time you've ever faced in your career? Also, how are you and staff dealing with the upcoming holiday season? Is the demand so great that there's no time off for you all?
As far as the acuity certainly is the highest I've ever seen. It's all of the patients in the ICU, typically before we'd have 3 or 4 or 5 patients who, were, critically ill. The other patients, they may have been, post-cath patients, simple pneumonias. Now it's every patient in the ICU is extremely ill. So the acuity certainly is higher than I've ever seen. As far as, fortunately, I've got a great partner, Dr. Imran Shawkat. So he and I, work together. So far, we've been able to continue. He works one week, I work the other week. So right now, we're able to maintain that. As the volume increases, I'm not sure that, one of us is going to be able to do it, for an extended period of time. Does that answer your question?
I believe it does, sir. Question for Dr. Dart from Samantha Vincent at Tulsa World. You mentioned we could soon reach the 6% mark of Tulsa County testing positive for COVID-19. How concerned are you that we could reach 10% of our population before a vaccine is in wide distribution, especially in light of the fact that every municipality in the county has adopted the same safety protocols, such as mask ordinances?
You know, as long as we continue to see the widespread and depth of transmission that is ongoing today, we will reach that 10% much sooner than we would like. And that's why in every press conference, we always talk about the 3 Ws, or the recommendations that we ask people to follow to keep everyone safe, of mask wearing, distancing, and hand washing. Because if these are the only tools that we truly have to mitigate spread and prevent transmission, and if we would all agree to come together and follow these recommendations, I think we wouldn't be having conversations about, do we meet 10%, 12%, or whatever. So if things continue the way they are today, we will definitely reach 10%. If we can really come together around ways to prevent transmission, if we do, it'd be a much slower and much longer period of time.
Thank you. Question for Mayor Bynum from Samantha Vincent at Tulsa World. Were you aware in advance of Governor Stitt's plan to visit a COVID unit at St. Francis Hospital, and did you two meet in any way to discuss your ongoing pandemic response?
I know nothing about Governor Stitt's visit to any hospital.
Okay. Fox 23, Rick Marinon for Mayor Bynum. How many businesses have been cited or penalized since the mask mandate enforcement was beefed up?
Again, that is now being routed through the health department. So Dr. Dart might be able to speak to that better than I can. But before I turn it over to him, I will say that the goal of the council and I is not to have people cited. The goal is for the health department to be able to go out and visit with the businesses that are raised to our attention and talk with them about what they need to be doing to operate safely. And if they refuse to do that, then they can be cited and even shut down. But the goal of the ordinance that we put in place is to put them on the radar for the professionals at the health department. And throughout this pandemic, going back to March, when we first started having to do restrictions on how businesses operate, I think the approach that the health department has always taken has been one of preferring consultation and getting people on board with understanding what the right thing to do is and then doing it, rather than knee-jerk penalties. Dr. Dart, I don't know if you want to add anything to that.
No, and Mayor, that's absolutely correct. You know, our goal is to really assure everyone that we're all in this together, and we're here to communicate and educate. We have issued no citations as of earlier this week. We've issued one warning, but as Mayor said, you know, we want to get people to truly understand the need for this. And so far, I mean, the business community has been great to work with and have been great partners, and I'm sure that will continue as the pandemic goes forward as well.
Thank you. Samantha Vincent at Tulsa World for Mayor Bynum. Some, but not all cities in Tulsa County have joined Tulsa in enacting a mask ordinance, or at least passing a resolution encouraging their use. How important do you believe it is that every jurisdiction in the county have some sort of standard in this regard? And how significantly has the lack of one impacted operations in Tulsa?
Well, I think to understand the importance of it, you have to acknowledge that we're a metro area. We are not individual cities that exist within bubbles. You know, Dr. Dart had sent me earlier on in the pandemic a study that showed that those cities that have the greatest rate of spread and are at the greatest risk are not necessarily the most densely populated in the United States. They are the cities that have nearby communities that they have great interaction with and human travel to and from, where those cities are not regulated in any way. Does that sound familiar? That's Tulsa. Unfortunately, we're the hub city in a region where there are still cities that are choosing, I'll just say it, the political out rather than doing what medical professionals are begging them to do. I've not always supported mask ordinances or orders. I didn't early on in the pandemic. Really wasn't until the summertime when our hospitals came to me and said, we need you to do this to slow the spread of the virus in this community so that we can keep up with providing treatment to people who need it. And when the medical professionals tell you what they need, and you're an elected official for a community, I think you have a responsibility to do something to address it. And I'm very proud of the fact that we have a council in Tulsa that, again, wasn't going to vote for it. It was going to fail until they heard from the medical professionals. And then it passed overwhelmingly. And we've since updated it twice. In this most recent vote on the week of Thanksgiving was unanimous. And I'm very proud of the fact that we have neighbors in cities like Jenks, Claremore, Sand Springs, Muskogee, who have taken the time and bothered to listen to the medical professionals and then have acted on their guidance and haven't put that on the same plane as Facebook epidemiologists who can cite some sham website and claim that that makes them an expert on the value of mask wearing or how to slow the spread of this virus. It is so important for us as a community when you hear stories like you hear from these doctors today. When you hear Dr. Worley, who has had a career in the medical profession, say that he's never seen the level of acuity that he sees in the ICU right now. And these are not random people, faceless individuals. These are our neighbors in this region who are being afflicted by this virus, who are suffering alone in a hospital bed with this virus because of the contagious nature of it, and all too many of whom are dying. And as we've said before, in our hospitals just here in Tulsa, over 2/3 of those patients are people who don't live in Tulsa. They're in communities outside the city of Tulsa who are coming here because we have the top tier facilities and professionals in the region to treat them, the latest equipment to treat them. And I'm very grateful that we do have those facilities. But we need other communities to put politics aside and step up your game. This isn't about appealing for your reelect. This is about doing what we have to do to save lives in this community. And as grateful as I am for the cities that have done that, I am equally disgusted with those who have not. Thank you.
Thank you, sir. To keep this meeting to just over an hour, we have one more question. Brady from KGRH, it's a two-part for Dr. Dart. Is a vaccine going to be free? Will you need insurance to get it? And do you believe teachers should be part of phase 2 vaccine distribution rather than phase 3?
Well, Brady, that's a really good question. And we have no plans to charge for any vaccine that we distribute. I think there could be a potential of an administration fee for some possible private providers, but I can't speak for that. Tulsa Health Department will not be charging for any vaccine that we give out. And then, teachers are, and this is just my opinion, but we want kids back in the classroom. I think it's important that children be in the classroom. And one of the ways that we can help achieve that is to elevate teachers in our priority list and put them in a higher phase so we can get at least teachers vaccinated and keep our teachers safe. So that's something that I would definitely support. And, where the phasing schedule has been very fluid in the planning process from the very beginning. That will continue to be fluid. So, nothing's written in stone so far, and every possibility for change in the phasing, it still exists.
All right. We appreciate everybody's time today. That concludes our press conference for December 9th, and we'll see you in the next one.
Thank you.